Schizophrenia. Introduction. Hello everyone, and welcome to our presentation on schizophrenia. Schizophrenia is a long-term mental disorder of a type involving the breakdown in the relation between thought, emotion, and behavior, leading to faulty perception, inappropriate action, and feelings, withdrawal from reality and personal relationships into fantasy and delusion, and a sense of mental fragmentation, are all factors that are caused by schizophrenia. In a sense, schizophrenia affects how one acts, thinks, and sees the world around him. This presentation will hopefully shed some light into the topic and the world of schizophrenia. Introduction. Now, during the course of this presentation, we will go through a quick background, the characteristics, the symptoms. We will also take a look at the causes. We will also take a look at some treatments and example of disorder portrayal. In addition, we will also touch upon the conclusion, and there will also be a reference at the end of the presentation. Background. A brief history. The word schizophrenia is less than 100 years old. However, the disease was first identified as a mental illness by Dr. Emil Kraepelin in 1887, and the illness itself is generally believed to have accompanied mankind throughout history. Written documents have identified that schizophrenia can be traced back to ancient Egypt and even as back as to ancient Babylon. It was generally believed before that schizophrenia was caused by demons or evil spirits in most of the cultures and civilizations in the past. Dr. Emil was the first one who split dementia from maniac depression. He also determined the onset and noted that there are a variety of signs and symptoms for the condition. He said that the schizophrenia consists of a series of states, and the common characteristics of which is a peculiar destruction of the internal connection of the psychic personality. Dr. Eugene Bleuler was the first one who renamed the disorder to schizophrenia, and he focused on the characteristics, the symptoms, on which was autism, and he emphasized fragmented thinking and the inability to relate to the external world. That's how he classified schizophrenia. Now, Dr. Kurt Schneider was more interested in the psychotic experience. He was interested in the hallucinations and delusion, the loss of self when an individual is experiencing schizophrenia, and what is the fantasy state, what are the triggers and the sounds and the images, and he identified specific types of delusions and hallucinations. So, for example, some hallucinations and delusions would be perceived as visual, whereas others would be more of a vocal. So, for example, you would hear things. This is what interested Dr. Kurt a lot. The essence of schizophrenia can be broken down into three main components. First being that it was originally called dementia precox, and it produces severe incapacity, so which is the dementia aspect to it, and it typically begins in adolescence. There are four characteristic differences between the normal neurological structure of the brain and that of someone suffering from schizophrenia. One, you can see that they have smaller soma. Two, they have decreased spinal density. Three, decreased dendrite length. Four, decreased presynaptic terminals. So how or why does this affect neurological function? Well, these four impairments affect stimuli and signals. It's similar to a train track with broken rails or signaling system that does not work. The diminished pathway affects the action potential complex, resulting in a series of neurological impairments. The dopamine hypothesis. This idea is pretty much an idea that has evolved into new evidence and has found that dopamine has a significant impact of psychosis and then ultimately schizophrenia. So in a nutshell, when dopamine levels are altered, in with those with schizophrenia, changes are seen in their psychotic states and personality. The significance of the disease. Schizophrenia is a tragic illness, also known as the cancer of mental illness. This is no surprise, as individuals who suffer from it go through quite the experience in their lifetime. It is chronic and progressive in nature, and it also has a rough 10% suicide rate. Thus, individuals affected by this disease have a 10% rate of committing suicide. And it's very common in the population, around 0.5 to 1% of the population. Now we'll talk about the complexity of schizophrenia. There is no significant defining feature of schizophrenia. There's multiple characteristics and symptoms. The symptoms from multiple domains. These domains include emotional, personality, cognitive, and motor activity. In a sense, you can say it's multifactorial in nature. Characteristics and symptoms. Characteristic symptoms of schizophrenia are separated into two groups, positive and negative. Positive symptoms are an exaggeration of normal psychological functions, for example, fantasy states. Negative symptoms are a lessening of normal function, for example, catatonic movement or behavior arising from a disturbed mental state. It may also involve repetitive or purposeless overactivity or resistance to passive movement and negativism. Positive symptoms are psychotic behaviors not generally seen in individuals, especially those that are healthy. In a sense, you can say they lose touch with reality, and this table clearly illustrates that. So for example, when you're hallucinating, the function that's disordered is your perception. And when you're delusional, the function that's disordered is your inferential thinking. Hallucination. Hallucinations affect perception. Hallucination can be divided into four subcategories. 1, auditory, which deals with the hearing. 2, visual, which are seeing things that aren't there. 3, tactile, feeling something that isn't present. And 4, your olfactory, so trigger and the memory. So an example would be the scent that sets off a reaction, a scent of your ex-girlfriend or a dead loved one. Delusions. These are the many types of delusions an individual with schizophrenia can experience. It goes from persuasion, so the belief that one's going to be harmed or harassed, to bizarre delusions that are evidently unnatural and impossible to understand. So for example, the sky is falling. Disorganized speech. Disorganized speech is a result from disorganized thoughts. There's an inconsistency in a thought or the inability to finish a thought before starting another. So responses to questions are mildly related or completely unrelated. These symptoms must be severe enough to impair communications. That's how you know that a person has disorganized speech. Disorganized or catatonic behavior. This is disorganized or abnormal motor behavior. Manifests itself in a variety of forms. Catatonic behavior is a decrease in reactivity to surroundings. It's rigid or bizarre posture as an example. Repetitive movements, so mimicking speech, flinching, staring, are all examples of catatonic behavior. Negative symptoms. Negative symptoms are associated with the diminution of normal emotions and behaviors. They're harder to recognize and can be mistaken for other illnesses, such as depression. Here, a table illustrates examples of symptoms and the functions diminished. So, alogia, the loss of thought, and the function diminished would be the fluency of speech and thought. Affective blunting, so it's the inability to express emotion, and the function diminished would be emotional expression withdrawal due to lack of emotional attachment. In the end, there are more examples. Importance of negative symptoms. Having these negative symptoms can really impair a person's ability to function in everyday life. It can make it difficult to attend school, hold a job, maintain relationship with family, do any sort of work, and overall live a healthy and optimal life. DSM-5 diagnostic criteria, the basics. This is some of the factors that are used in the DSM-5 to identify schizophrenia. As you can see, it goes from characteristic symptoms present for at least 1 month to social and occupational dysfunction, and duration is greater than 6 months, and the symptoms are not attributed to mood disorders, and the symptoms are not due to substance abuse of drugs, medication, or general medical condition. Now, with that being said, at least 2 of the following must be present, each for a significant time during 1 month period, or less if successfully treated. These include delusions, hallucination, disorganized speech, disorganized or catatonic behavior, and negative symptoms. Criteria B. Social occupational dysfunction. For a significant portion of time since the onset of the disturbance, 1 or more of the major areas of functioning, such as work, social relationship, or self-care, is significantly below the level achieved prior to onset. When the onset is early in childhood or adolescence, failure to achieve the expected level of academic, occupational, or social achievements. An example of this would be relationships and social anxiety, attendance at work, or school. Criteria C. Overall duration. Continuous signs of a disturbance must persist for at least 6 months. Then during these 6 months, there must be at least 1 month of symptoms that meet the criteria A, and may also include periods of residual symptoms. During the residual period, signs and symptoms may be manifested by negative symptoms, or 2 or more symptoms listed in the criteria A, presented in a lessened form. Example, odd beliefs or unusual perceptions. Criteria D. Schizoaffective and mood disorder exclusion. Schizoaffective disorder and mood disorders with psychotic features have been ruled out because A. No major depressive or manic episode have occurred concurrently with the active phase symptoms, and B. If mood episodes have occurred during active phase symptoms, their total duration has been brief relative to the duration of the active and residual periods. Criteria E. Substance and general medical condition exclusion. Now, the disturbance is not as a result of the direct effects of substances, so drugs or abuse of medication or general medical. Causes. The causes to schizophrenia are unknown. However, there have been many different theories. These theories include neurodevelopment hypothesis, genetic vulnerability, substance use, urbanacity, and parental and gestational exposure. Now let's examine some of these theories. The neurodevelopmental hypothesis suggests that there's a disruption in development of the brain. So the brain is affected as the child is being developed. It's either in the first or early second trimester, and this increases frequency of complications in the schizophrenic patient. So it can cause hypoxia, ischemic injuries that can ultimately affect the brain. Now, taking a look at genetic vulnerability, is those who have family history of the disease and have significantly increased risk for developing schizophrenia. So for example, if you have twins, one identical twin has schizophrenia, the other one has a 50% chance to develop it as well. One gene is not enough for a person to develop a psychosis, however. The genes involved in psychosis only increases vulnerability to psychosis. Recent research and studies that have shown that mutations on chromosome 1, 6, 8, 12, 13, and 22 have been found to increase the risk of developing schizophrenia. Now, taking a look at substance use, it has been hypothesized that cannabis, also better known as weed, increases the risk of developing schizophrenia. Recent research has identified that the active ingredient THC poses a threat to users, and in addition, amphetamines, LSD, ecstasy, and carotene ingestion have also been theorized to cause the psychosis. Urbanacity. So, urban upbringing is, if you're up in an urban upbringing, you're 2 times more at risk of developing schizophrenia compared to a rural setting. The various lines of evidence suggest this is the case because of the physical environment and social disadvantages, and increased rates are seen in the first and second generation immigrants. And there's also a risk amongst individuals that live in more densely populated areas, and the risk decrease amongst minority ethnic groups living in areas with higher density of their own ethnic group, which is a pretty interesting fact. Treatment. Perinatal and gestational exposure. Now, a variety of prenatal exposure have demonstrated association between an increased risk of schizophrenia, such as being stressed, having an inadequate amount of nutrition, low birth weight, prematurity, and viral and bacterial infections, and prolonged labor, and neonatal hypoxia. And this raised incidence of schizophrenia amongst people born in the winter months. So there's seasonal variation in the rates of intrauterine viral infection. The treatment. So is schizophrenia curable? The answer is no, although many would argue that. It's, however, it is very treatable. It can be managed. It basically entails choosing the right treatment that works for the patient. So 2 methods we're going to take a look at is the non-pharmacological therapy, so psychotherapy, and pharmacological therapy, so psychotic therapy. Now, the non-pharmacological therapy. This is psychotherapy is treatment based on the relationship between the psychologist and the patient. So you're getting support. You have someone to talk to and have an open conversation with. And what this does is allows you to express how you're feeling, allows you to release some stress. It also helps with serotonin levels. It supports a person, and it's a backbone for an individual to have some sort of support. And rehabilitation therapy can help a patient regain their confidence as well to start living an independent life. Now, the pharmacological therapy. The pharmaceutical intervention, what it does is aim to minimize the rate of relapse, the and reduce hospital admission rates, and minimize the symptoms and functional impairments. Dosing is allocated based on the patient's reaction to the drug. And in an acute case of schizophrenia, drug treatment is administered with maintenance therapy. This helps to increase socialization and increase self-care and mood. And drugs that block postsynaptic D2 dopamine receptors are also common treatments. So what they do is they divide into two subgroups: first generation antipsychotics and second generation agents. To continue, the side effects may include the following: dyskinesia, so purposeless and involuntary body or facial movement; Parkinsonism; akathisia; dystonia, which is muscle contraction, sort of like twitching; and second generation antipsychotics, they generally have a lower affinity for dopamine receptors, and they also block serotonin receptors, which is not a good thing. Now let's take a look at haloperidol. This is a first generation antipsychotic. It helps restore the balance of neurotransmitters in the brain. It is used to treat aggression, uncontrolled movements, and hallucination. Side effects will include dizziness, sleep disturbances. You'll have problems using the washroom, and you may even get anxiety. Now, we will look at a study on the effectiveness of psychoactive drug treatments for schizophrenic patients. Now, the background, let's go through the background. So it was published by the New England Journal of Medicine. So they want to determine the effectiveness of old generation antipsychotic drugs compared to a number of newer generation drugs in treating patients with schizophrenia. The drug effectiveness was based on the number of months patients adhere to the medication before they stop using the treatment, and the reason for their discontinuation. So drug ineffectiveness and intolerable adverse side effects. The method was that approximately 1,500 patients with schizophrenia were recruited from different institutes across America, and they were randomly allocated into one of the five groups that were given one of the five antipsychotic drugs. So the drugs listed below, and number of months the patients adhered to the medication before discontinuing the treatment, and this was all recorded. Now the results, so the main finding. Results found that 74% of the patients stopped the medication before 18 months onto the study. Olanzapine was the longest used treatment without discontinuation, making it the most effective antipsychotic drug treatment. Examples of portrayal of disease. Stigma of schizophrenia. Stigma of schizophrenia. So stigma is a negative stereotype surrounding mental illness that can be harmful to an image, and schizophrenia is no stranger to negative stereotypes. The stigma behind schizophrenia has caused many not to talk about or seek help. It can lead to self-medication like drugs or alcohol, and this leads to worse health outcomes physically and mentally, and can also cause social isolation and trouble finding stability in work and other obligations. And this is why there is a 10% suicide rate of individuals that suffer from schizophrenia. Now, the portrayal of schizophrenia in media, and it's no stranger in the media. There's quite a bit of examples, but the one that we chose is the movie Split. movie about Kevin, who is a homicidal schizophrenic. So he's Caucasian, he's male. They show him as being aggressive, abusive, and violent, which is not always the case, and brash in judgment, which is true from time to time. And psychosocially and ethically, he's imbalanced, and he has homicidal behaviors and somewhat supernatural powers. This is how a schizophrenic is usually seen and portrayed in the media. Here's a quick cartoon portraying schizophrenia. So it's two individuals talking to each other, and the individual with schizophrenia is saying, "My med spoke to me this morning." His friend asked, "What did they say?" He said, "My meds aren't working." So this is kind of showing how it is for a person with schizophrenia, how they experience things. So he basically had a false reality experience where he believed that his meds were talking to him. So it goes to show you how dire the situation can be with an individual with schizophrenia. But this cartoon is more of a mockery than it is a piece of understanding, or a piece of something to understand schizophrenia by. Myth and misconceptions of schizophrenia. People with schizophrenia are violent. People with schizophrenia are lazy and irresponsible. Associated schizophrenia with multiple personality disorder. That's what people usually do. They usually associate the two. And treatment and therapies are not effective. Now, there's this notion that individuals who are schizophrenic, they hear voices. This is what the stereotype usually is. They hear voices, they're always isolated, and they don't like associating with people, and their whole reality is just skewed. This is not always the case. This is just how media has portrayed schizophrenics. So schizophrenia is a character flaw rather than a manageable illness. And as I said before, media and movies, they portray them as violent criminals. And they use derogatory terms such as schizo or psycho or psychotic or even schizophrenic. So the truth is that treatment for schizophrenia renders them no more violent than anyone else. A person with schizophrenia is more likely to harm themselves than others. And when a person with schizophrenia commit violent acts, it is highly likely that they will not receive proper treatment or therapy. So what can we do about this? You can join communities, learn and inform yourself, and get useful information from online websites. Conclusion. So much has been learned about schizophrenia since its discovery over 100 years ago. And first and foremost, schizophrenia is episodic mental disorder. We've learned that the symptoms occur in episodes rather than consistently throughout the patient's life. And the prognosis is good for people suffering from schizophrenia. And evidence suggests that schizophrenia is largely caused by genetic factors rather than environmental factors. There are also many theories on the cause of schizophrenia that include neurodevelopment, substance use, urbanicity, and perinatal exposure. And to help treat schizophrenia or control it, there's pharmacological therapy, drugs, and treatment and psychotherapy support, and other effective treatment options. The DSM-5 does have a criteria to classify what schizophrenia is. And according to researchers, schizophrenia is a tragic illness. It's also known as the cancer of mental illnesses. However, with that being said, people that suffer from schizophrenia have a more positive outlook on their life, as hospitalization is not the only option anymore. And there's also research and new advances that are being made on the central nervous system to hopefully understand this disease even better and to get rid of it, hopefully once and for all. References.